Barbara Epps of the Area Agency on Aging of Broward County was a presenter at our April 24 Sunrise, Florida Rotary Aging Gracefully Seminar. She described the many programs and services available to individuals aged 60 and older in Broward County, Florida, including health and wellness classes, home assistance, Medicare Counseling, food assistance, and much more. She also informed us how their agency assists seniors with dementia and their caretakers.
I'm very happy to be here. I'm the Outreach Director for the Area Agency on Aging of Broward County. And to follow what the Alzheimer's Association was talking about, my husband and I took care of my mother for 4 years with Alzheimer's. And actually at the time I worked for Broward Health. And he still is, running senior facilities. And even with all of that knowledge at our fingertips, I didn't realize what the area agency could offer us for assistance. So I want to tell you about it tonight. Okay, so who are we? We're a nonprofit. We serve Broward County seniors ages 60 and over. It's funny, I was just at an event and I said that, and all these people with gray hair were like, I'm not a senior, but that'll be good for my parents. So I started thinking, maybe I should say individuals ages 60 or older. I think the word senior scares people. I don't like to be called that. So anyway, we've been around a while. This is our 50th year anniversary. We are one of 11 area agencies in the state of Florida. We plan, develop, coordinate, evaluate, and provide programs for services for seniors. And we also operate the Aging and Disability Resource Center, which people may be familiar with, the AGRC. We have like 3 different names. It can be very confusing, and I apologize for that. When I first started, I'm also responsible for marketing. I said, can we just go down to one name? But apparently legally we can't. So these are the 11 area agencies on aging throughout Florida. The different colors denote the different agencies. You can see we are the sole pink spot, and that's because Broward County has so many seniors, they gave us only one county. Some of them have 6, 11, a lot of different counties because they have rural areas. There is an 800 number. If you know someone somewhere else in Florida, you can tell them this 800 number. They will take them and direct them to the area agency in their area. Now, we have similar programs between the agencies, but we're a little bit different too. Okay, so our front door is our helpline. And this is staffed by information and referral specialists. These are employees that go through about 2 months of training to learn everything we have to offer. So then when someone calls up and says, I need help with meals, I don't have any food, they will address that concern, but they'll also start asking other questions so that they might find out this person needs legal aid, or this person needs help with their Medicare counseling. So that helpline is really our front door. It's the first number you could call. It's available Monday through Friday, 8 to 5. We have individuals that speak Spanish, Creole, Russian. We also have a language line, so if we don't have someone that speaks the language that you need, we can work through the telephone language line. Our offices are in Sunrise, not too far from here. We are on Hiatus. It's about a block down from Commercial, so it's really close. Okay, so I already talked about the helpline. Not only for seniors, but we also assist persons with disabilities ages 18 and over. Not everybody knows that. We are also the first stop if someone wants to apply for Medicaid long-term care. We have people who do the screening over the phone. If you qualify, then we also have people that counsel you through the whole process. There is a wait list for this. That's just a reality, unfortunately, but people are assigned a number, so the higher your acuity and your need, you will be higher up getting the service. We do provide meals. We have meals that are home delivered. We fund congregate meals at different various senior centers throughout Broward County, so those are free meals. We provide assistance guiding people towards SNAP, which is food stamps. So we have several different ways we can assist people with meals. That's unfortunately a common need that we hear about from seniors. We can assist with emergency home energy assistance. If someone gets a disconnect on their Florida power and light bill, we can assist with a grant that we have. And all of these so far, you call the helpline. That's like the first step, call the helpline. We have a nurse intervention program. If we get a call that someone's worried about somebody, we can send someone out to their home to assess them. We also work with different city EMS departments in partnership. So they come to us if they need a wheelchair for somebody. Again, we're just trying to assist people in any way that we can. On the other side of the slide, we have our health and wellness programs. I didn't mention at the beginning, we are funded by the Older Americans Act and also by the Florida Department of Elder Affairs. So the Department of Elder Affairs has evidence-based programming that we have been trained on, and we utilize volunteers. But these volunteers, we train them on how to do these classes. So for example, Matter of Balance is a class that teaches seniors exercises to help decrease the incident of falling. And it also addresses the fear of falling, because sometimes as people that get older, they're so nervous about falling that they get stiff. They're not walking naturally. So it's working through that and trying to improve that. Along the same lines, we have Tai Chi. Tai Chi for arthritis is one of the examples. Again, we have instructors that are trained to teach the class. If you've ever seen Tai Chi, it's a very slow, measured, calming exercise, and it also assists with fall prevention. And then another example is living healthy with chronic conditions. This can be diabetes, asthma, heart disease, and it's a group class, and it has discussion and learning within it. We have another program that's run by volunteers. This is called SHINE, Serving Health Needs of the Elderly. This is near and dear to my heart. This is one that I'm over with the grant that we get from the Department of Elder Affairs. We have an amazing group of volunteers that assist with the counseling. And you may wonder, how are they qualified to provide Medicare counseling? I thought that when I first started. Well, what I've since learned, the Department of Elder Affairs puts them through a vigorous training. They have to go through 8 modules online to learn about Medicare, and then at the end they have to pass a test. But then they're not done. Then they have to be mentored by an experienced counselor for about 6 months, and they listen to counseling and they talk about the different scenarios. So it's wonderful, it's unbiased, it's free. You can do it over the phone, you can come to our offices. We have them going to different satellites at senior centers. So there's all different ways that we can assist you. Speaking of senior centers, we also fund senior centers and daycare centers, and we also fund the transportation. You've seen probably if you go to a daycare center, there might be a bus that can pick up people, take people places. We help fund those means of transportation. We can also assist with minor home repairs, doing grab bars, helping with plumbing. We can't replace your roof, that's too big. But we can do minor things. We can also help with legal assistance through our partner, Coast to Coast Legal Aid. We don't do it ourselves, but they're our partner, and again, that's free. And then as was mentioned, there is a veteran-directed care program which does provide a stipend for family members who are caring for a veteran, and we can help people go through that program. Okay, Alzheimer's. We are partners with the Alzheimer's Association. My CEO is actually on their board, and we do have a lot of programs to assist not only people with Alzheimer's, but their caregivers. Somebody in the audience was asking what is being done for caregivers. Well, we have a conference coming up on May 14th. We did this conference for the first time in 2022. It's at the Parker Playhouse. In 2022, we had never done it before. Over 500 people came. It just shows you the need out there for information. It's a free conference. Lunch is free. This year, it'll be from 8 o'clock to 3 p.m. and there's several different panels. We're going to be putting out some advertising on it. You may see one panel that interests you and you just want to come for that one. That's fine. You may want to stay all day. That's okay too. But I really encourage you, if you're in that situation or if you know somebody in that situation and they need assistance, please tell people about it. We also have a program called T-Care. This is a program that we have 2 individuals who assist caregivers. They give them an assessment, what they're going through, and then they try to pair them with the resources that they need. So that is also free, and you just call the helpline and they can direct you to the T-Care team. And then last but not least, we have caregiver training and support that is online. We recognize the fact that if you're caring for somebody, it could be hard to leave them and go to a support group. So this is online. It's on Mondays, either 9 a.m. or 4:30, and it's an hour each. In addition, we assist with case management. We have medical equipment and supplies we can provide people, and I think I covered everything else. We have also healthcare navigators. Sometimes people call with really complex problems, and so we have individuals past the helpline that can help them go through and find the right services that we have that match their needs. Then we have a cool program. This is called United for Seniors. This is in partnership with United Way and Broward College. So we take students from Broward College who are in either social services or maybe nursing, and we pair them with seniors. You know, they get a background check, they go through a training, and then we pair them together, and they just do things together. It's a wonderful program. One of my favorite couples that was creative is there's a nurse in her 40s. She is Russian. She came over here. She's going to school at Broward College to become a nurse. She's not a nurse yet. But we paired her with a senior who's also Russian, so they can speak Russian together. So do they go to church together, they go shopping together, and when you hear something like that, it's like, it just seems like a match made in heaven. The next one is similar, but not in person. It's our Connecting With You program. This is for people who have the time and would like to help seniors who may be living alone, who are lonely, who are looking for companionship, and they just commit, again, it's a background check, but they call seniors. They can call them once a week at least, or 2 or 3 times a week if the senior wants that and the volunteer is willing to do it. But it's just a hello, how are you? Is there anything you need assistance with? Because sometimes they tell the volunteer something, the volunteer tells us, and then we can give them the service that they need. We also have a grandparent support group. This is for people that are eligible ages 55 plus. Most of our services are 60 and older, but this particular one is age 55 and above. And then we can do some home assistance in-home services. That could be helping with personal care, homemaking, respite care, emergency response units. I already covered the other. Okay, this is a fun part. My CEO has been with the agency probably for 4 years now, and when she came on board, it was right before COVID started. Everybody was isolated. Seniors were alone in their homes, alone in the assisted livings and the seniors facilities. So she started looking at technology that could assist them. Since then, so what, fast forward, right, 4 years, 3 years, whatever it's been, these are all the technologies, and I'll try to go through them all. I couldn't bring them all tonight, but if you go on our website, we have videos and you can view them and see how they do. The first one is called LEQ. This is an AI robot. It's about yay big, and it sits on a desk or table, wherever you want to put her. And she is a she because she speaks as a female voice. She's pretty, I wish I could have brought her tonight. She's pretty amazing. She's similar to Alexa, but she goes many steps further. So let's say that LEQ is in your kitchen and you walk in the morning. She'll sense you walking in the room and she'll say, "Good morning, Barbara. How are you today?" And I'll say, "Hi, LEQ. I'm doing good. How about you?" "I'm okay." And then she might say, "How'd you sleep last night?" I say, "Oh, not too good. My back hurts." And she'll ask, "Well, on a scale of 1 to 10, what's your pain?" So I'm serious. This happens. So then she'll say, then you'll answer, "Oh, it's about a 6." And she'll say, "Would you want me to call your daughter? Because you can put in a contact in there for assistance." So no, I think I'm okay. Okay. Well, the next morning, "Hi, Barbara. Hi, LEQ. How are you feeling today? How's your back?" She remembers. So the conversation can continue. She also initiates conversation. So she might say, "Do you want to play a game?" I think it was at the SALT meeting here in Sunrise. We played a game, and I actually stumped her. It was 20 questions, and I had to think of somebody famous, and she asked me questions, and in my head I had Elvis Presley, but she guessed Freddie Mercury. She had kind of the same era. But it's just ways to engage the senior as they were discussing being alone, not being socialized. Obviously, this is not a real person. She has like a bobblehead, but she doesn't have a face on it, and that's on purpose because we don't want people to, if they're getting dementia, to think this is a live person, because it's not. It's a robot. But it's entertaining and it's educational. You can take classes, you can do exercises, so it's pretty cool. Then we also have Ring video doorbells that we can provide for free. You just have to call up, make a request, and you can either pick it up or we can install it. This is a safety concern. We want people to be able to see who's at their door, be able to speak to them, particularly if you're living alone. We have robotic pets. I have with me the dog and the cat. I have them turned off right now because they get kind of noisy, they get excited. The dog will, they don't walk around with her, they're not like walking robots, but they're for companionship. Again, the dog will bark, he'll blink his eyes, he wags his tail. Cat will purr, she blinks her eyes, she rolls over on her back. So it's just companionship. Yesterday I was with the film crew from Channel 4. They interviewed a husband and wife couple, and they both said he has arthritis and sciatic pain, and they said it didn't take the pain away, but the distraction and the happiness and the laughter that they're having with them has really made a difference in their lives, which is lovely to hear. We also have emergency alert response systems, which are free. We have another product called Uniper Care. This is a device that connects to tablets or TVs. Kind of similar to LEQ, but it's not interactive, but you can go on it and do exercises. You could take tours of other cities around the world. And this was really popular during COVID because, again, people were home alone. We have It's Never Too Late tablets. These are tablets that are particularly designed for seniors. They're a little bit larger. The icons on them are larger, so they're easy to figure out. There's programming in it that is something that would interest seniors. So those, again, are free. And then last but not least, we have Tranquility Lifestyle Solutions. Somebody here was telling me they had heard about this. This is the latest one we got. This is a radar disc that they put in 5 different rooms in your house. There's no cameras, there's no listening devices, but it takes radar images of everything in the house as well as the person, and it knows what is the individual. If that individual falls and doesn't get up, there's a 24-hour command center. They will call the house. If the person is still not moving and doesn't answer, they call their emergency person. If they don't answer, they call 911.
There are videos and information on our website about that as well. So to end on, we are on social media. We are on Facebook, Twitter, which is now X, LinkedIn, and Instagram. So you can follow us on that. Please do. I invite you to. We also have a monthly newsletter. You can go to our website and sign up, or I have a sign-up sheet. If you sign up for the newsletter, it's only once a month. You'll be kept abreast of everything new that we're doing and learn new things, and we'd love to have you following us. Last but not least, I forgot one thing. On my table too, there's this thing called a file of life. This is a little piece of paper. You can put all your medical information and medicines, put it on your refrigerator. If the police or the paramedics have to come into your house, the firemen, they know to look for this, and it gives them valuable information. So thank you very much.